This is Will to Win, Overcoming Long COVID. My name is Jillian Angeline, and my goal is to raise awareness about the hundreds of millions of people worldwide who are struggling months and in many cases years after contracting COVID. I know a little something about that myself. I got COVID back in February of 2020. 6 surgeries and more than 5.5 years later, I'm on a road to recovery and healing, but it hasn't been easy. Of course, these episodes are for informational and educational purposes only. They do not constitute medical advice. Please talk with your medical professionals and anyone on your medical team before trying anything we discuss during this episode. Now let's get started. Today's guest is Dr. Alexis Cutchins, a cardiologist. Hi, Dr. Cutchins. Thank you so much for talking with me on the Will to Win Overcoming Long COVID podcast. I really appreciate your help, and it's such a pleasure to meet you after hearing so many wonderful things about you for the last few years.
Thank you so much for having me. It's great to be here.
So first of all, the phrase venous insufficiency has actually become a hot topic. Tell me a little bit about your definition of venous insufficiency. A lot of people are trying to explain that phrase now in the public. It was a shock to me to start hearing that phrase because I've been dealing with that world for so long, and now it feels like everyone's talking about it.
Yeah, it's sort of, I think of the venous system in general as like a forgotten organ system. Like we don't learn much about it in medical school. No one really knows what to do with it. And so learning about venous insufficiency, all of a sudden, everyone has to know what it is. It is kind of an interesting topic, right? But venous insufficiency is when the valves in the veins of the lower extremities stop working properly. So you have valves in the veins of the legs, and those valves help keep blood moving back to the heart. The way that blood goes from your toes to your heart is through a system of valves. So the muscles in your calves and your thighs help contract the venous system and push blood up towards your heart. But in order for that blood to not backflow back down, there's a valve there. So it's like this system where it's like a pump and wait, pump and wait, pump and wait. At each valve, there's a different level where the blood gets to, right? And so when you move your legs and you contract muscles, blood inches its way up towards your heart. Okay. If the valves aren't working properly, so that can be from multiple reasons. The veins can be dilated out so the valves don't meet, and the valves then can't hold the blood up, so the valves don't meet. Or if the valves are really floppy and they just sort of stop working and they just flop down, then when your legs are trying to contract that blood up to the heart, the blood just goes up and then back down, up and then back down. And when it goes up and back down, that's venous insufficiency or venous reflux.
And that was happening to me as someone with long COVID. Those valves were messed up in a lot of the veins in my legs, and that's why I had my veins ablated. For a lot of people, compression stockings or something along those lines might help to get that strength back in the legs, because there's definitely a feeling of heaviness and weakness
associated
with a lot of venous insufficiency or just like swelling in that area.
Yeah.
But sometimes compression is not enough. You need to do a little bit more. And that's when people like Dr. Spencer come in, interventional radiologists, who can put something in those veins to close them off, correct?
Right. So what happens when you have the main vein, the greater saphenous vein, the GSV, is the one oftentimes that we sort of shut down. So we shut down the vein by using a radio frequency ablation, or a wire that we introduce into the vein and then pull back slowly with radio frequency. So we basically shake the wire in the vein to scar the vein down. And when the vein gets scarred down, it's out of commission. And what happens is there's a lot of other veins in your legs. And so all the other veins in your legs start working instead. So the blood starts getting returned through those veins, and those veins have competent normal valves. And so you get better venous return because you're bypassing that large vein.
It's incredible. So you're a cardiologist by trade, but you're talking about the venous system. You talk about pelvic venous disease. You're often talking about iliac vein stenting. How does a cardiologist end up in the venous world? Tell me about that.
Yeah.
That connection.
So, as a cardiologist, we do lots of vascular disease, right? Most of us spend our career worrying about arteries, especially the coronary arteries. But a lot of times we worry about the peripheral arteries, so like blockages in the arteries in the legs, for instance, that provide blood flow to the foot. I started looking into the venous system because I was taking care of a lot of patients with POTS, postural orthostatic tachycardia syndrome, which a lot of patients with long COVID have. And, in that disease process, we use a lot of compression.
Hmm.
So we use compression. Patients feel better because their legs are compressed with, a garment of some sort, a stocking, a sock, a sleeve, whatever it might be.
Hmm.
And so that got me thinking, well, we treat venous insufficiency the same way. We use stockings and compression to
Hmm.
treat pooling in the lower extremities from venous insufficiency. So maybe what we're treating in POTS is actually venous insufficiency and not other forms of pooling. So I started looking for venous insufficiency in patients with POTS, and that's what took me down this road of learning more and more about the veins. It turns out, almost all of the patients that came to see me for POTS had venous insufficiency in the lower extremities. So there is a connection there. There are other reasons why veins dilate in POTS because the autonomic nervous system isn't working quite right. And so you can get some relaxation of the veins, but they have venous insufficiency. So I learned about the lower extremity veins first, and I started treating venous insufficiency in my patients, and they were feeling better. And I thought that was great. As a cardiologist, I like to fix things, and POTS is not easy to fix. So I was pretty excited when there was something that I could, interject into these patients, and it worked. A lot of these patients also don't tolerate medications very well, or there's many medications that they can't take. And so to have something that was more tangible that I could just get in and out and, send to the vascular surgeon and have them fix, that was exciting for me. But then I learned more about the veins and I started talking to people like Dr. Spencer and others and realized that all of my patients, for the most part, also had pelvic venous disease or more proximal venous disorders like obstruction of the iliac vein or the renal vein. And when that happens, then you get more pooling in the lower extremities. The valves fail in the lower extremities. So they're connected intimately. And I started looking for that in my patients and asking questions about symptoms of pelvic venous disease, which are, pain in the pelvis, pain in the vaginal area, pain with intercourse, lower extremity pain, lower back pain, like you're sitting for a really long period of time, you start getting this ache in the lower back that can come from venous pooling.
Hmm.
You can get urinary tract symptoms, you get leg symptoms, obviously. And so I started asking those questions of my patients, and all of them had all of those symptoms. So then we started looking for the pelvic vein abnormalities. So that's how I got introduced to the venous world. It's just a matter of looking for root causes of disease and being curious about why these patients are experiencing what they're experiencing.
And my mom's been saying this for the last 5.5 years of me dealing with long COVID is I was never like a why me attitude. Woe
Mhm.
is me. It was always, how do we fix this? Let's
Right.
fix this. Let's get back to the way it was. And my mom, who's an engineer, it's a mechanical issue.
Yeah.
There's something going on mechanically. And when you talk about the valves and everything, she said that when I was, practically dying on her back in 2020. There's some
Right.
mechanical issue that's causing this, but at the time, it was so hard to find doctors like yourself or Dr. Spencer or Dr. Vaughn, because everyone was in their own little world. And it was hard to just realize that you're going to have to go outside of your region. I mean, you talk about Dr. Spencer, who's in Colorado, who I've dealt with extensively. You talk about Jordan Vaughn, who's Dr. Jordan Vaughn, based in Alabama. And then you talk about yourself in Atlanta. We talk about doctors like Dr. Vicia Pretorius in South Africa.
Yeah.
This is a teamwork aspect to be able to help a lot of these patients get better. You talk yourself about sending someone to a vascular surgeon. What is that teamwork atmosphere like for you as you continue to help these patients get their lives back?
Yeah, it's hard, actually. There aren't a lot of people doing what we do. There's a lot of skeptics. You know, in order to sort of figure out new things, you have to go against the grain a little bit and you have
Mhm.
to do things that other people aren't sort of willing to take the risk to do, unfortunately. And so it can be lonely, actually. There's not a ton of people out there who understand this population of patients.
Mhm.
So when you find people who do, you latch on and you don't let go. And so I've created a lot of connections to people who do understand this population, which has been super helpful and very rewarding for me. Because when I can talk to another physician who's seeing the same thing I am, that means the world to me, because then I don't feel as alone in this process. Um, but I use doctors from all sorts of walks of life. Patients have a lot of gastrointestinal symptoms, so I try to find GI doctors that are very aware. I use vascular surgeons, I use interventional radiologists, I use neurologists. So we have there are a lot of people in the mix here that are trying to help these patients. But there's, one in Colorado, or one in New York, and one in Atlanta, and one in North Carolina. It's not like they're all in one place, in my easy, hometown, kind of, working together, which is, ultimately what I would love to see is a center
Mhm.
where we have multidisciplinary physicians all working together that are like-minded, who want to take care of the same population of patients, and who understand that what they're going through is real. And we'll see, maybe someday I'll have that.
That's interesting that you mentioned how lonely it is. I can also imagine it's frustrating. I've had experiences now where I've had having done a couple or one podcast with an interventional radiologist based in North Carolina. I had a patient reach out to me through social media and said, "Hey, I heard your podcast. Can we talk about your experience?" And it's
Mhm.
so hard sometimes to talk with patients and hear about their stories, because I have similar stories myself from my experience. But when you also hear from someone else, I just want to throw a magic wand and help someone.
Yeah.
And I don't have the training, the knowledge. All I can do is talk about my experience and provide hope that it does get better, and do whatever I can. But I can imagine it must be frustrating on your end, because you're also not trained to go in and start fixing someone's veins, right?
Right. Yeah. I need people to do that for me. I don't personally do those procedures. So, I'm working on a network of those doctors who do that. But you want someone who's going to do it right, and you want someone who's going to take the patient seriously, and you want someone who has experience with venous interventions, which is, most vascular surgeons deal with the arteries. They don't
Mhm.
do the veins. Sometimes they retire and they open up like their vein clinic, down the
Mhm.
street, and they, treat varicose veins, because they're bored. But that's about the extent of vein work for a lot of these vascular surgeons. Some of them have figured it out, and some of them are really invested. And I've got to meet them too. I've gotten to meet them and, work with them and learn about what they're seeing. And they're seeing the same stuff I'm seeing, which is super gratifying. They tell me
Mhm.
I have patients with POTS, and their POTS gets better. Their long COVID gets better when I fix their veins.
Mhm.
So that is very validating to the experience that I'm having with my patients. So,
Tell me about the work that you're doing right now. You were with Emory for more than a decade. What's next for you?
yeah, so I had a great experience at Emory. I was so happy to have that time there. I learned so much, and I really grew as a physician. But it, I got to a point where I felt like I really wanted to focus on this population of patients, and that I would be better off doing that on my own. And so
Mhm.
I made the decision to leave, which was really hard to do. And I've decided to open up a private practice in New York City, which is where I grew up. So I'm going to be opening up a practice in the fall, probably October, fingers crossed, that will, primarily take care of patients with POTS and long COVID and autonomic dysfunction. And I'm hoping that that's going to expand someday into a larger sort of center of excellence. That would be the plan. So get multiple doctors from multiple disciplines, physical therapists, psychotherapists, all different nutritionists, dietitians, these patients need a lot of different providers, and I want to get them all in the same place to help patients. So that's like the pipe dream. What I'm starting with is just me, and we'll see how it goes. In the interim, I started an Instagram, so I've been talking about POTS on Instagram,
Mhm.
and trying to educate patients there. I've started a YouTube channel. I'm hoping to get some longer, more educational materials out there. So we'll see what happens.
That's so exciting, and I think
Yeah.
that does provide a lot of hope for people that want to be able to have that one-on-one time with you as well. So that's just awesome. So you're getting out the word via social media, via shows like this, and how are you hoping to find your patients?
A lot of my patients from Georgia want to continue to see me over telehealth. So we're going to start there.
Mhm.
But, I know some people in New York. I'm hoping to get some referrals there. I
Mhm.
also know that the Facebook community in this population of patients is huge.
It
And
is.
I would say I grew my practice in Atlanta purely from word of mouth through those Facebook groups of my patients saying, you should see Dr. Cutchins. She's great.
Mhm.
And so I'm hoping that that same experience will happen to me wherever I go, you know, and that people will come find me.
What's the process of opening up your own practice? Are you learning as
Yeah.
you go, like learning as you build the railroad tracks?
Yeah, I have mentors for sure, and people like Dr. Vaughn and Dr. Spencer, right? They've done this before, so
Mhm.
they're helping me. But
Mm.
um, it's a whole new experience. They don't teach you how to run a business in medical school. So I really am starting from like ground zero here. But I'm learning along the way. It's a matter of, finding a lease on a location. Okay, so once we get that, then we start, building out that space, and then I can start hiring people to work with me. I get a sonographer. I'm going to do lots of vascular studies, so I need to get that implemented. I mean, there's a lot to learn, but I'm, kind of a curious person and I like learning new things. So I figured I could handle it, hopefully.
I'm just so excited to hear that you're going also to New York City, which was really the epicenter of the COVID pandemic in the early years. I got COVID back in Maryland, but it was from a case that came from New Jersey, we think. And so, New Jersey, New York, there are a lot of long haulers that need the help. And also because it's New York City, there's easy access to airports. So if someone wants to fly in and see you, it'll be a lot easier, I think.
Yeah, I'm excited. I mean, New York City is home for me. I grew up in Brooklyn and my parents live in Queens and my sister lives in Queens. My brothers are in Brooklyn. So
Oh.
it's nice to come back. It's nice to be closer to my family again. And, it is, I think there's a lot of patients there that need to be seen. Like I think there are a lot of patients with long COVID and POTS who are
Mhm.
looking for doctors to listen to them and believe them and understand why they're having the symptoms they're having. And
Mhm.
unfortunately, that doesn't really exist in lots of the US, but I know that there's plenty of need in New York City. So I'm hoping to help patients there like I did here in Atlanta.
So, if someone's listening to this and maybe has a number of symptoms that may be tied with venous disease or venous, malfunctioning of their leg veins or of other areas, what kind of symptoms should they be looking out for? And do you have any advice for them as they try and figure out what their next step is? Should they be finding a doctor in their area who's an expert in this and maybe going to them and seeing what they can do to help them? They probably need some kind of ultrasound to check all that information. There's a lot to be considered because I know that when I've listened to discussions like this, I always want some actionable items in order to figure out maybe, but also, this is not medical advice. This is just actionable items for someone that may be listening and wants some hope.
Yeah. I think it's interesting. A lot of the patients that I see with long COVID tell me the first symptom they had with their COVID infection was actually leg pain or pelvic pain. And, no one's asking that question, but it's real. It's definitely there. So I think a lot of people don't realize that the leg discomfort, leg heaviness, feeling like you're walking through cement or sort of like stuck and you can't really move your legs, that's usually venous insufficiency.
Mm-hmm.
And that is a symptom of pooling of blood in the lower extremities, and that can be fixed. So there's lots of places who do lower extremity venous ablations. The issue is that there's also most likely a more proximal obstruction. So there's probably iliac vein compression or pelvic venous disease as well. And that can cause symptoms like pelvic pain, low back pain, sort of the stuff we touched on earlier.
Mm-hmm.
And that's a little bit harder to treat or to find someone to treat because we're still learning about, what the treatment for that is. And, is it stenting the iliac vein? Is it sclerotherapy to the varicose veins around the pelvis? In my opinion, I think that patients need to have that obstruction relieved
Mm-hmm.
because that's what helps blood return to the heart. And in my world, I like to think of the venous system as everything, that's what's supplying the heart with blood. And if the heart's not getting blood, then it's not pumping blood out. And if the heart's not pumping out, then you're getting dizziness, you're getting brain fog and fatigue, you're getting tachycardia, you're getting all these other systemic symptoms. It's not just leg pain, it's not just pelvic pain, but it is, cognitive issues and, low flow to the brain, right?
Mm-hmm.
So
Wise
if you're
words from a
having,
cardiologist.
yeah. So if you're having all those symptoms, and if that's something that's there that can be fixed, I won't say 100% of the time it works, because in our data, that's not the case. We have data showing it's about 70% of patients who have their pelvic venous disease fixed have improvements in orthostatic intolerance. But we don't know what's going on with that other 30%. Did they not get their veins treated properly? Was there still venous disease that needed to be treated, as you experienced, right? Like, did we have to go back and do something else? And so we're still learning a lot. And so if you do want to be evaluated for iliac vein compression, renal vein compression, that sort of thing, you really need to find someone who's an expert in that area. And that can be someone like me who can look for it. I can't treat it, but I certainly could find it. Or it could be someone like Dr. Spencer, for instance, in Colorado, who sees patients all over the country and orders MRIs, all the time, looks at them, finds it, and then fixes it for patients.
And has a special protocol too. It's not just like, okay, just ordering a random MRI. She has the specific protocol of shots that she needs, or I mean, I call it shots from the broadcast world, but pictures she needs and
Right.
images she needs, and a
Right.
certain way of gathering this information in order to confirm.
Yeah.
That.
But also the issue is, when those studies are read by a radiologist, they're not always read completely, I should say. Some of the radiologists have feelings about diagnosing iliac vein compression or pelvic venous disease. They feel like it's more of an incidental finding and not a finding that could be actually causing symptoms. So they won't necessarily say it's there, even if it is. And so, you go out, you get this MRI done, your primary care physician orders it, they believe you might have this problem, and then the report comes back and it says everything's normal. But if you send that MRI image to Dr. Spencer or to me, we will tell you it's not normal, right? So everyone is still really learning about this. It's not, it's just not very straightforward, and it's a young field, unfortunately. So, but a couple actionable items that you can do. So if you're having all these symptoms, one thing you can do is keep your legs elevated. And if you're having symptoms after standing for a period of time or sitting for a period of time, you can lie on your back and put your feet up against the wall. That helps bring the blood back to your heart and helps you sort of reset. And sometimes I have patients do this multiple times a day. Like, every 2 hours, just lie on the floor, put your legs up for 10 minutes and get a reset. And if you do that and you feel better, then they may give you a little bit of a glimpse of what's going on, right? Like, it could be that you're pulling blood in your lower half of your body and you need this reset, right? The other things you can do is like use compression. I have recommended for people to get like a little bike pedal to put under their desk. So if you're sitting at your desk all day, you can put your feet on a pedal, like a bike pedal underneath the desk, and it just moves your legs so that you keep your muscles working throughout the day. And that helps aid with venous return and blood flow back to the brain when you're sitting for a long period of time. There are other things like, you can just tap your feet or shake your legs or whatever. You don't need to have the bike pedal. It's just something, that some of my patients use and find helpful. And then compression, obviously compression socks, compression hose, anything that goes all the way up to the ribs is best. There's also abdominal compression. You can get these like binders that go around your abdomen or sleeves that, help support your back and your pelvis. And that can be really helpful to prevent venous pooling.
I never liked anything tight on me growing up. Like, even just socks. I was weird about tight
Yeah.
socks on me or anything. So the concept of wearing like compression for 2 weeks after some of these surgeries, I wasn't worried about the surgery. I was more stressed about having to be in compression for that long. And so that has been some of the biggest challenges after these surgeries, because the thought of having that kind of compression, even if it made me feel slightly better, like, oh my gosh, just
right.
It's hard, but it does work.
So many of my patients have that same symptom, right? Like, a lot of people feel have this like tactile aversion to compression, but also, if you have some mast cell dysfunction, those mast cells can get triggered by some compression. Might act up and make you feel uncomfortable. So another thing that I recommend is like a pneumatic compression. So you can get a boot that blows up on your leg, and it sort of sequentially pushes fluid back into the venous system. And you can do it for like 30 to 60 minutes a day. So it's not compression all day, but it's just like a one-time episode of compression, right? Where you get all that fluid back into the venous system and then you sort of reset. So that's another thing. You can buy them off of Amazon. You can get cheap ones. You don't have to buy the $1,000 ones. It's not necessary. There's another device out there called Firefly that you wrap around your calf, like the top of your calf, and it just pulses. So it has your calf muscles contract. It makes your calf muscles, it's sort of like a TENS unit a little bit to the calf. It makes the calf muscles contract. So that contraction is helping move blood out of the legs and back up. So there's a lot of different things you can do. You don't have to go out, get a procedure. You don't have to have a stent to your iliac vein, although those things can help substantially. But if you're listening to this and you're like, I might have that, what can I do? Those are some things that you could sort of low-hanging fruit.
But of course, this is not medical advice. They should check with their doctor,
Yes.
their medical teams before they go and buy anything like
Right.
that, because everyone's bodies react differently to something.
Yes.
So it's always important to be able to check with your doctor, check with your, any specialist that you're connected with to be able to say, hey, I heard about this. Do you think this might help me with my situation?
Absolutely.
Do you feel like long COVID, and in your experience, is affecting more women than men from your experience?
Yeah, absolutely. I do. I think in general, ever since I started taking care of patients with POTS, there were more women than men. In the POTS world, it's about 4 or 5 to 1. I think that long COVID has sort of even the playing field a little bit. More men are developing symptoms, but I do believe that genetically there's a little bit of a predisposition. Some people are more predisposed to getting complex chronic illness. And women that's heightened in women. So genetically speaking, like if you have a boy and I have a girl, they have the same genes, they should have the same risk, but women's risk is higher, in my opinion, because of fluctuating hormones. So the estrogen and progesterone cycling in our systems does disrupt things and cause other sort of cascades of events to occur that make women more symptomatic from their exposures to viral illness or anything else that's going to cause them to sort of develop that complex chronic illness.
And then we're getting towards the end of our discussion. Of course, this is the Will to Win podcast. My goal is to focus on bringing hope to people that may be in some darkness right now because they're suffering. They want to be able to get better, get their life back to where it was, or even just see improvement. Do you believe that there's hope? I feel like with all that you're doing, there's definitely hope in your mind.
I think there's absolutely hope. I think in part it's finding the right people to get you to that place. So, and that isn't necessarily a doctor. It could be a Facebook group or a support group, someone where other people are in your position and, you're bouncing ideas off of each other. I will honestly say I learned the most about long COVID, POTS, caring for complex chronic illness from my patients. They bring me things and I'm like, oh, well, that could work. Let me, look into that. Right. So I think there's a lot of hope. And I think that all of the support from podcasts and Facebook and, the internet in general has been really helpful in terms of bringing these issues, these complex conditions to light for, more research, more study, more awareness, more doctors are learning about these things. And I think that that's super hopeful, in terms of getting, curing this, complex disease in the future.
If you have comments or suggestions, I'd love to hear them. Find me on Instagram, Angeline_travels, or on X @JLAngeline. I'll see you later.